వెల్కమ్ టు తెలుగున్ హెల్త్. నేను మహాలక్ష్మి. ఈరోజు మనం హైటెక్స్ హెచ్ఐసిసిలో ఉన్నాము. యాక్చువల్గా సిప్లా వాళ్ళు ఇక్కడ ఎగ్జిబిషన్ ఏర్పాటు చేశారు. ఇది మొత్తం చూసుకుంటే డెర్మటాలజీకి సంబంధించిందండి. స్కిన్పై ఎట్లా ఉంటుంది, స్కిన్ కోసం క్రీమ్స్, అట్లాగే స్కిన్ కేర్ కోసం కొన్ని ప్రొడక్ట్స్ కూడా ఇక్కడ పెట్టారు. ఇక్కడ చూసుకుంటే మొత్తం ఇదంతా హాల్ మొత్తం ఇట్లా ఇవి ప్రొడక్ట్స్తోనే నిండిపోయి ఉందండి. చూసుకుంటే మీరు చూడొచ్చు ఇక్కడ.
So the highlights are to make people aware of the delegates from all across the country, including the Tier 2 and Tier 3 cities, about the benefits of these new drugs, which have made the treatment for conditions like psoriasis, atopic dermatitis, urticaria, etc., a little easier. I would never say we have found the ultimate cure, but we are dealing with conditions which don't have a cure. For example, psoriasis can go on as a chronic, potentially relapsing disease for a lifetime. So if I see a teenager at the age of 17 years having got psoriasis, I have to make that person prepared mentally that this problem may keep happening on and off till the age of 87. So we have to walk them through with a lot of hand holding, and when we run out of ideas through the use of conventional drugs, phototherapy, small molecules, then many of them would need biologics too as a very useful arm to give them good quality of life.
And so what are some of the trigger factors for psoriasis?
Psoriasis by definition is a condition which is caused due to inflammation which starts from the skin and which then can lead to systemic inflammation. It's seen in people who may be genetically predisposed to psoriasis, and the episodes of psoriasis are known to be triggered by things like stress, which is increasing day by day, things like change of weather, especially the colder climate. So many of them see worsening in winters. You see increase with dryness of skin, you see increase with injuries, you see increase with eating habits like alcohol and smoking. And when they have a lot of high calorie rich food like high glycemic food, that may make psoriasis worse. Likewise, uncommonly some certain medicines and some infections in the body can also worsen psoriasis. These are some of the triggers. Skin care, as the social media would make my patients believe, is all about cleansing, moisturizing, using a sunscreen and toner, use of toners. But in real world, we need to ensure that the skin is cleansed regularly with a gentle cleanser which should not add to the dryness of skin. In addition, after cleansing, we should use a moisturizer to ensure the barrier function of skin is not affected, because the dry skin with unhealthy barrier can lead to aggravation of conditions like eczema and psoriasis. While cleansing, we have to also tell them to avoid very hot water for bathing, to avoid prolonged bathing, and they should restrict their bath to 10 minutes. We don't see any role of toner scientifically, but a sunscreen at daytime, especially if you have outdoor activity, does help us, because besides the knowledge that the aging of skin is more on the sun exposed areas and you will retard that aging, there are many skin conditions which are either caused by or aggravated by exposure to the UV rays present in sunlight. Therefore, sunscreen should be used properly and regularly. When we talk about sunscreens, we have to be sure that it should be applied in adequate amount, and one application in the morning does not suffice because it loses its efficacy in 3 hours. Therefore, it should be repeated. And the quantity that a person should apply is something like, if I can show with my fingers, you take it on the tip of index finger and take it beyond the first crease. That much amount should cover half the face. That means double of that amount should be applied to cover the entire face. And think of how much more you need to cover the arms and the neck. And it should be applied on all the sun exposed areas. One more thing while we use a sunscreen is that it should not cause acne in young people. Secondly, it should not make people sweat profusely because otherwise patients feel uncomfortable and with sweat the effect is lost.
వెల్కమ్ టు తెలుగువన్ హెల్త్. నేను మహాలక్ష్మి. మనతో పాటు డాక్టర్ ఆశిమ్ శర్మ గారు ఉన్నారు. వారితో మాట్లాడదాం.
Namaste.
What were the main highlights of Dermacon 2024, sir?
So, Dermacon 2024 was all about bridging the gap between clinical and aesthetic dermatology. We had a lot of good discussion on psoriasis, atopic dermatitis. These are diseases which affect general public, and sometimes people don't understand how these diseases work and what treatments work for them. So, a lot of focus on newer treatments like biologicals and small molecules, over and above how to control our immune system so that we don't keep getting triggers for psoriasis and atopic dermatitis.
Great. So now coming on the role of biologics, sir. So how do you see that discussion happening at Dermacon 2024?
So a lot of good info on biologicals. We have a lot of new molecules which work. And just to put it simply for all of you, biologicals are injections which are very targeted. So they will target only one part of the immune system which is dysfunctioning, which is causing you to get psoriasis. So it's a very tailor-made therapy, very simple to use, and something with one injection your quality of life improves. You have a much better quality of life, with a very limited treatment, and you're not suppressing everything in the immune system. See, when our system is overreacting, we want to suppress one part of that system. We have molecules which suppress everything, but if you have that one target which is being suppressed, I think that is a winner, and that's what biologicals do for us.
So what is psoriasis and what are the early triggers?
So, psoriasis is an autoimmune condition. It comes with red patches which are scaly and itchy, and often the first symptoms are itching. So people will start getting itching. As Indians, all of us are an oily race where our faces and scalps are very oily. So you'll start getting a lot of itching in the scalp. You'll get these red patches which will flake off. It looks like somebody's, that the patch has dandruff. And once that scaling gets worse, then the patch becomes very thick and those scales fall to the ground. So when you comb your hair, you'll actually have scales which come to the bottom of the floor. And it's very embarrassing for patients. It's very debilitating. And even people around keep asking what has happened to you. And just to answer triggers in psoriasis in a very quick way. So, psoriasis is triggered by stress, by sleep. Please remember it's an autoimmune condition, which means your own body is reacting against your own skin and causing these patches. So, anything which triggers your body, like extreme stress, it could be physical, emotional, or psychological, lack of sleep, if you're not, taking the right medications at the right time, if there is something which is lingering in the backdrop, and a certain other conditions like, there are arthritis or joint pains which are involved in patients with psoriasis, nails can get involved. So these are a few things which can trigger psoriasis.
So psoriasis is a chronic inflammatory disorder, and due to the chronicity and difficult to treat nature, it has always been a challenging condition for any dermatologist. But gradually we are moving to a more target-specific therapies in form of biologicals and other small molecules from the era of non-specific immunosuppressives. So today psoriasis is not about only corticosteroids, which common people think are the mainstay of treatment. They think that psoriasis is a disease which cannot be cured, which is not true. Like many other lifestyle modifying disorders like hypertension, diabetes, psoriasis is also being a chronic disease, but patient can definitely lead a healthy and peaceful life, both socially as well as professionally.
See, Dermacon 24 in Hyderabad, it is one of the leading conferences in dermatology. Of week 5,000 to 7,000 delegates. Of late, I think 6,000 delegates are registered this time. And psoriasis is many diseases, almost all diseases that we see in day-to-day life are covered, and all the updates are taken. That's the most important thing. Whatever the updates in dermatology occur about the new drugs, the new disease patterns, all these things are taken into consideration. New papers are presented. What are the new treatments that are evolving? So these are taken into consideration. So that is all.
What are the triggering factors for psoriasis, sir?
Psoriasis has got multiple triggering factors. First, it is a genetic disorder of HLA-C-W6 gene on the Soros gene. Now, what happens is that there are multiple triggering. Your alcoholism may be a triggering factor. Your stress can be a triggering factor. It can be steroid therapy itself can be a triggering factor. So, psoriasis has got multiple triggering factors. You need to control these things.